afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and Healthline 3 is a conversation we have with local health experts, and you have the opportunity to join the conversation in just a couple of minutes, and we'll tell you how to do that soon. But today's topic is avoiding neck and back injuries, especially during the holiday season. And joining me today to talk about this is Dr. Milan Mody, an orthopedic surgeon with the Orthopedic Clinic with Willis Knighton Health in Shreveport. Thanks for joining us.
Thank you for having me today.
And Merry Christmas.
Merry Christmas.
Absolutely. Okay, so tell us a little bit about what you do as an orthopedic surgeon.
So I'm a orthopedics trained spinal surgeon. So I focus in on conservative, non-operative, and operative care of the spine. So that includes the neck, back, also includes scoliosis, includes like spinal trauma. So when people have a spinal fracture or spinal cord injury, you know.
Gotcha. Okay, so kind of all-encompassing neck and back, spine,
That's
all
right.
that good
That's right.
stuff. Okay, and so it is the holiday season. It's in full swing, and you mentioned that neck and back injuries are very common throughout the year, but you might see an increase maybe around this time of year, and maybe why is that?
That's right, because Christmas is a very busy time with holiday shopping, gift returns, decorating, undecorating, festivities and fun with your family and friends. But it's also can be hazardous, because of increased traffic on the roads and in the airports, heavy lifting, stress, climbing ladders for the decorating, as well as heavy lifting, and slips and falls that happen. And most of those injuries are just muscular or ligamentous, which means they're not that difficult to treat. But some of those injuries can also be broken bones, spinal cord injuries, herniated disc, and those definitely need to be treated appropriately. Absolutely,
yeah. And I even think about, so you mentioned like heavy lifting, you've got the big boxes maybe that you're bringing in from like a UPS order or something, but also I do a lot of baking around this time of year, and I'm kind of leaning over, hunching over, I've made a ton of cinnamon rolls this week, and I was rolling things out with my rolling pin, and I could tell that was causing a little bit of stress on my back, maybe not anything super serious, but that could also maybe contribute to it as well.
That's right. So when you cook or you bake, you do a lot of bending and twisting, and so using proper body mechanics is very important. And getting help, if you're going to be doing some big pot of gumbo and it's heavy, get some help, before you either drop or, twist your back doing it. Holding things close to your body is more important, and if you're going to turn your body rather than twist your body, if you're lifting something heavy, lift with your leg muscles rather than your back muscles, and so that helps. So when you squat, keep your back stiff or straight as you lift the box up. Because then you're lifting with your strongest muscles, with your leg muscles, rather than your back muscles, which are kind of weaker muscles.
Yeah, and that's where you probably see a lot of the strain is when people are in a rush. They're not really thinking about those mechanics, and then before you know, you've got like this pain, and then compounded with stress. I'm sure that doesn't help as well.
That's
and
right.
Not sleeping as much. I haven't been sleeping as much because we've got family in town, so you're visiting. So yeah, lots of different things going on this time of year.
Yes.
For sure. And do you feel like do you actually see a rise in these cases, or do you feel like it's pretty comparable to things that happen during the normal year?
We do see a rise during this time because of all the things we talked about earlier, that you have increased stress, increased traffic, so that also leads to distracted driving and car accidents. And then of course, with festivities, people can, they're having fun with their family and friends, but at the same time, some things like a family football game or family pickleball game can get competitive, and then we in our heads, we are 18 to 20, but our bodies may be 40s, 50s, and 60s, and so that does not bear properly with some of those activities. So we do see an increase or a spike in these kind of cases in terms of neck and back injuries, along with things like hip injuries or shoulder injuries and knee injuries.
Yeah, and so most of the time it's maybe you could just do like physical therapy and kind of get back on track, or other things that you would provide, maybe not as severe as surgery. So what are some of those things that patients could come see you for that maybe they're like, I don't know if I need surgery, but what are those preventative things we can do beforehand?
Sure. So rest, the body part that's been injured, ice it in the first 24 to 48 hours. Ice works better than heat, and then after that, heat can take over. Anti-inflammatories like Tylenol or ibuprofen are also very good. So doing that for a week or two, if those things get better, if your pain gets better with those small changes itself, then you don't need to see a physician. But if they're not getting better, or if they're progressing and getting more painful, then it's definitely important to see a physician.
Yeah, so definitely listening to your body. And I know this time of year, it's like, well, we've got so many things going on. I'll worry about my health in the new year. And so like you're saying, it's probably better to just get it checked out when you can to avoid anything that's more serious.
That's right. So if you like things that would be more serious, like you said, pain coming down the arm, weakness in your arm, pain coming down your leg, or weakness in your legs, or your legs giving out, those are signs of herniated disc or spinal cord or nerve impingement. And those are very, very important to make sure you get those checked out sooner than later.
Absolutely. Well, if you're just joining us, Healthline 3 is a conversation with local health experts where we like to focus on ways to live a healthier, happier, and pain-free life. And we're taking your calls right now and answering your questions in the studio today, and those phone lines are open. That number is 318-219-4569, and it's right there on your screen. But when you do call, make sure you're in a quiet room and turn your TV all the way down so that we can hear your question. And again, 318-219-4569. We'd love to hear from you. Okay, so also I think about, going into the new year, maybe more people are exercising and working out in the gym. Do you feel like, do you also see maybe an increase in injuries around that time with neck and back injuries?
We do. So I can't emphasize this enough, but it's stretching, stretch. It's very important to stretch before and after those new activities or exercises you're going to do. Learn the basics. If you're going to start a new sport, you're going to start a new exercise routine, learn the basics before you become a weekend warrior. Because it's very important to kind of ease into it. Get a friend or a family member who knows that sport or knows that exercise routine, or a trainer, if you can afford one, to help you with those sort of New Year's resolutions, because when people will sort of indulge in sweets and treats, they also get a Santa belly, and then they also get a Santa spine in terms of pain. So it's very important to kind of treat that with your New Year's resolutions.
Yeah, that's really important. I think a lot of people neglect stretching, including myself, so that's a good reminder for me, and I'm sure many others. Well, Lori, thank you for joining us, and what is your question for Dr. Mody?
Yes, I have scoliosis, and I'm 60, so I don't want the surgery. I think it'll be too much. Or do you think it would be too much, or just an exercise program to help with it?
So being 60 is, believe it or not, old anymore. We're all living into our 80s. The average lifespan is about 80 to 84 right now in the U.S. So there are definitely things we can do for scoliosis even at 60. One of the things we do is get you active. So I think a lot of patients with scoliosis, they get a weaker back, and their back muscles are weaker. And so getting physical therapy and home exercise program is very important. Sometimes it can just be spinal injections, that can help. A lot of times the proper body mechanics that you learn from us as well as from the physical therapist to do it. Very rarely do people as adults need surgery for scoliosis.
Okay, do you do the injections in your office?
So we do the injections, when spinal injections are done, they're done in a procedure or a surgery area, because they should be done with sterile technique. So you have to have an x-ray machine that looks at where the spine is and what area we're injecting, and then put the needle kind of where that spinal problem is at. And so we're pinpointing and sort of doing a sniper attack on the problem with that x-ray machine. So it has to be done in a proper setting, so not done in the office. The office injections are just muscular injections. So those are the ones you get in your primary care office or our office. They don't last as long, and they're not as targeted.
Gotcha.
Okay, well, thank you. I'll call next week and make an appointment.
Well, thank you very much, Lori. Merry Christmas.
You're welcome.
Yeah, thanks, Lori, for joining us. And if somebody was wanting to get in, your clinic, especially maybe into the new year, what's a good phone number that they can reach out to?
Sure, they can reach out to us at 318-212-3610, 318-212-3610.
Okay, and we have another caller, Tammy. Thanks for joining us. And what is your question?
I don't have a question. I just wanted to tell Dr. Mody a Merry Christmas and Happy New Year.
Well, Merry Christmas, Happy New Year to you too.
We love
Is
that.
there a way to strengthen your back when your back is bad? How to strengthen your core when you have a bad back?
Yes, most definitely. I think you hit the nail on the head with the core. So the core muscles are the muscles that are holding us erect. So those are the muscles in the front of our spine, which is in the abdomen, as well as the muscles in the back of our spine, which we call erector spinae. So strengthening those muscles really helps people with back issues. There are multiple exercises you can do. You can find them on YouTube. Simple exercises. If you type in core exercises to strengthen my back and do a little search, you'll come across many physical therapists on YouTube providing you tips and pointers how to do the exercises. You can go to Amazon and buy a book. One of the books I recommend is Treat Your Own Back by Robin McKenzie. Again, very, very cheap book, very thin little book, $10 to $12, and it really is a home exercise program you can do to strengthen the core muscles for your back.
And probably things you can do at home.
That's
as
right.
well.
Exactly.
So easy. Mm-hmm.
Thank you so much.
Thank you very much. Merry Christmas.
Yeah, that's a great point to strengthen the core, and it can be something as simple as right before you go to bed, on your carpet while you're watching, on your rug while you're watching TV in between commercial breaks or something, while you're watching KTBS in
That's
between
right.
commercial breaks and doing some of those exercises can be really helpful. Yeah, so good tips there. So we are at this point in the year where we're thinking about taking down those Christmas decorations that we already used the ladders for to, put them up. So any tips that you would give to people watching at home that are getting ready to take those down in the next couple of days?
Yes. So use proper equipment. So you want to use a step ladder or a proper height ladder. So sometimes people try to overreach. So they'll get a short little ladder and they're trying to overreach and they kind of go on their tippy toes. So it's very important when you're using a ladder or even a step ladder or step stool to have a firm placement of your ladder, so good position of your ladder. Get somebody to spot, especially if it's a ladder. Get a responsible older child or an adult to actually spot you, that they're going to stand there and not be distracted with a cell phone, and they're actually spotting you. And then you have to focus on three-point contact with the ladder, so proper shoe wear. And so both your feet are firmly planted on the ladder, not with flip-flops or barefoot. That gives you that sort of grip on that ladder. And then, so that's 2 points. Your third point is one of your arms or your hands, rather than both your hands being kind of up in the air doing something. Making sure you don't get in the top 2 steps of the ladder, because that's definitely not recommended. Again, find a ladder that's properly, with proper height for the job you're going to do. I tell patients, if you can afford it and you need to go onto the roof to do things, get a professional, because most of us are not prone to those kind of heights, and most of us are not going to do well in those heights.
Right, makes me think of the Christmas movie, Christmas Vacation, when he's on the roof and things go bad, and he probably needs to see somebody like you afterwards. So,
that's right.
So those are really good tips for sure. And I'm sure you've heard some stories. I don't know if you've had any to share that you can think of.
Yeah.
Recently.
So one of the stories that sticks out of my mind is a wife of a physician who was putting the box of decorations back into the attic and lost her footing, and then had a neck injury, and so we had to take care of that. So these are the things that we kind of say, well, get help, and if a box is too heavy and you're going to be on kind of unsure footing, then be careful and maybe make smaller boxes rather than one big box. We all get in a hurry, and we want to kind of get things done beforehand. Why that story sticks out of my mind, because the physician had told the wife that I'm going to be home later and we'll help you take down the decorations, put them up. And so wait for
Right.
family or friends, and wait for them to help you, you know.
Yeah, that's so true. And it just makes me think of, every week when you go and get groceries, it's like, get it all in one trip instead of
That's right.
taking one. So yeah, it probably helps you to take those smaller trips and not lift as heavy. Because a lot of times you're in awkward placements. It's not like you're holding a barbell, when you are in the gym, or a dumbbell. It's all like weirdly distributed weight. And so it could be on one side or the other, and you could be, hurting yourself without knowing it.
Correct.
Yeah, and so, which brings up another point of, what does it mean, like, is there a difference between being hurt and being injured?
Yes. So as we talked about earlier, being hurt is something that after maybe a week or two, things get better. Your bruising goes away. You're taking your anti-inflammatories, and your pain is getting better. You're sort of decreased your activity, and then your pain is getting better. If you find that even when you rest, you find that even with Tylenol and ibuprofen, icing it, you find that the pain is not getting better. It's actually getting worse. Or if you have pain at rest, those are things that means that there's an injury.
Yeah.
So there's a true injury, sort of deeper down than just a sort of superficial injury. So it's a deeper injury. That's what really needs a diagnosis and kind of come see us, and then we get the proper treatment.
Yeah, okay. And so, yeah, you probably wouldn't want to wait at that point once you're at a point where it's pretty painful, it's not really being helped with the over-the-counter medications. That's probably when they'd want to call you.
That's correct.
And this is kind of a busy season. We'll get to the call in just a second, but this is kind of a busy season for you. So how soon, if somebody called you right now, can they get in to see you?
We're closed today and tomorrow for the
Yeah.
Christmas holidays, but I think they were going to call, on Thursday. They would probably get them in on Friday or Monday, so we could probably get them in
Okay,
pretty quickly, depending on. And then I have multiple partners who can also see patients if it's shoulder related or neck, sort of knee related.
Yeah.
Then we can get them in with the proper specialist.
Cool. Well, Jean, thanks for joining us. And what is your question for Dr. Mody? G. Sorry. Can you hear us?
Oh, okay.
Yeah, what's your question?
I'm GB. My back has bothered me for a while, but now I've gotten to the point where to pick up the slightest thing, it kind of draws me open. It's hard for me to stand straight back up. It's really hard. I can't get out of the tub. I cannot work around my yard like I used to.
So it sounds to
If
me
I
like
don't do anything like picking up stuff, I can stand up. But once I pick up something, bend me over, I have to get somewhere to sit down.
Yeah, it sounds like this has been going on for a while, Gene. It's definitely something that we can help, number one, diagnose, and number two, treat, or at least get you an understanding of what's going on. But we find patients, who've had it for months or years. Some conditions get progressively worse, So those are conditions that are definitely necessary to at least understand what we're dealing with. So it'd be. You're definitely somebody that would say, look, let's not try to focus in on doing home exercises. Let's make sure that we you see your primary care doctor or have us see us as a specialist to help you diagnose and understand what's going on.
Mm-hmm. Yeah, because again, it's something that maybe has been ongoing for a while. It's not something that you can stretch and, see relief from. So at that
That's
point,
right.
it's important to go see someone like you.
Yes.
So. Okay, so you mentioned this briefly earlier, talking about just traveling in general, and there's a stress, hustle and bustle. I mean, Uri Drive is probably crazy. I'm going to avoid it at all costs today. And even afterward, a lot of people like to go shopping right after Christmas with their Christmas money and stuff. But, traveling to go see family members, whether that's flying or driving, that can cause maybe some wear and tear. You're sitting for long periods of time. And what kind of stress does that put on your neck and back?
Yeah, so very good questions. So let's I guess focus on the driving part. You know, so let's say you're driving somewhere and it's 8-hour drive. I tell patients, look, get out after 1 or 2 hours, stretch your legs. You know, take a bathroom break, take a meal break. That gets the blood flow going, and also gets the joints moving. So stiff joints lead to painful joints. And same thing for passengers. You know, so if you get out after 1 or 2 hours and for a break, it also helps. And let's say you cannot get out for every 2 hours or so, at least do some exercises inside if you're a passenger in the chair, you know, as you're sitting down, keep the joints moving, you know. Getting a proper back cushion or a proper sort of buttocks cushion is important if you're going to have prolonged driving, you know, because someone has back problems, and that really helps out, you know.
Yeah.
I think hydrate, you know, since we forget that we need to hydrate when we're traveling, whether it's in the car or with air travel, because hydration leads to better joint fluids, you know.
Yeah, and I know it's like, well, I don't want to drink water because then I have to, you know, stop for a bathroom break and it prolongs the drive, but that is important. So,
That's right.
Virginia, thank you for joining us. And what is your question for Dr. Mody?
Yes, I've had scoliosis, still have it, but I've had 3 back operations, and I now have 3 broken ribs, and I keep breaking them and pulling them apart. Is there anything I can do?
Have they done any sort of bone density study on you, like to see how good your bones are?
I have osteoporosis, yeah. It's pretty bad.
Yeah, and that's what it sounded like to me when you told me about the broken ribs. You know, so patients with osteoporosis will tend to get broken spinal vertebra, will also get broken ribs from minor trauma, such as just rolling in bed. But in the last 5 years, we've had some really drugs come out that are game changers in the osteoporosis world. So things like Forteo, Prolia, Tymlos, Reclass, these medicines have changed the game for osteoporosis. I would definitely recommend you see either your primary care doctor, us, or a rheumatologist to make sure which is the right drug for you, because these medicines can increase your bone density, your bone mass, and it has really changed the game for osteoporosis and osteoporosis treatment.
Do you like Prolia?
Well, I guess it depends on you know, every patient's individual. So the treatment you want to be is idiosyncratic. So I think having a look at all your sort of kidney function and your liver function, other ones will kind of help determine which is the best medicine for you. So for some patients it'll be Prolia, some patients might be Tymlos, and for others might be other ones, you know.
Okay. Okay, thank you so much.
You're welcome. Merry
Yeah.
Christmas.
Yeah, thanks for joining us. And if you have a question, you can give us a call at 318-219-4569. We're talking about neck and back injuries that typically occur around this time of year. And, you know, so we were talking about on the road travel before we accepted the call. But what about, you know, flying? You know, you're sitting down even more. You might be more restricted to sitting down. But why is it important to move your joints?
Yeah.
You know, what's the science behind that?
Yeah, so again, science behind that is stiff joints. So after a while, after 1 or 2 hours, our joints get stiffer, and it gets even stiffer as we age. So especially patients in their 50s, 60s, 70s, and 80s, this is really important for, is to kind of move around, either it's in their chair or in their seats or exercises to keep their joints moving, or get up and walk, you know. So you'll see those people that are walking up and down the aisle. It's not because they're anxious, it's because they're doing what they're supposed to do for their joints, you know. So staying still in one place is not always going to be great for people's backs. In fact, prolonged sitting causes more back pain than other things. So if you have knee problems, hip problems, back problems, then I think getting up and walking around is important.
Yeah.
Or at least do the in-chair exercises, you know, that they recommend. And you'll see that in the back of your sort of in-flight magazine or the safety card, you know, some of the exercises they tell you to do. The other thing that it does, it also increases the blood flow in your legs and decreases the chances of a blood clot. You know, so when you get older, like in their 70s and 80s, people can get a blood clot if they have prolonged sitting, especially on air travel.
Yeah, very good tips there. And I think a lot of times we think maybe if we don't have a desk job and if we're up and moving, sitting or standing or walking, I feel like those really aren't like dynamic movements of the stretching that you would probably recommend. So it is important to maybe stop what you're doing throughout the day, even if you're, your regular work day, not just during the holidays and when you're traveling, but to stretch and get things flowing.
That's right,
So.
yeah. And if your workplace, you talk about the work and prolonged sitting at work, if your workplace will allow you to have a variable desk, a desk that kind of lifts up and you kind of with a push of a button kind of goes up, so then now you're standing, kind of like how an architect stands and those kind of things. It really helps out. So you can do 30 minutes sitting down and 30 minutes standing up, whichever way you choose, but at least it gets the blood flow going and allows you to work at a different sort of setting.
Yeah, good tips. And even now it's super unpopular to have like a walking pad underneath the desk, the standing desk, so you could also walk while you're, working or taking Zoom calls and things like that, so you're a little bit more active throughout the day. So, okay. Yeah, so, we talked about ice versus heat when you have these mild injuries or, if you recently hurt yourself or if you have a sprain. But again, remind us like which one is indicated for different types of injuries.
Yeah, so initially when you hurt yourself, let's say you fall down and you have a bruise and it's swollen. So if you have bruising and swelling, that usually means there's increased blood flow. So in the first 48 hours, ice is better on those areas. So whether it's your back, buttocks, knee, ankle, whichever area there's a swelling and bruising, ice it for the first 48 hours, And when I say ice, you want to apply ice not directly to your skin, but you want to kind of put it in a plastic bag and then maybe have a towel between you and the plastic bag so you don't get bit of a frostbite type effect, or you have one of those ice packs and, again, keep something like a t-shirt or a cloth between you and that ice pack. And then after that, then heat can be better, so after 48 hours or so, heat can be better. Now some people don't tolerate the heat, then you can go back to the ice as well. But in the first 48 hours, ice is better.
Okay, very interesting. Okay, so holidays are a stressful time for many different reasons. You just name them, and it's a stressful time in some way. Whether that's just like hosting families, and you have to figure out how you're going to provide food for everyone, or maybe a loss of a loved one, and this time brings up those stressful thoughts. But how does stress impact the potential for having an injury or hurting yourself?
Yeah, so we all carry our stress, majority of us carry our stress in our neck muscles, in the back of our neck, our shoulder muscles, and then we also develop like a stooped posture, so our posture becomes a little stooped when we are carrying stress. So those kind of things definitely hurt the neck and back areas, Stress also leads to a little bit of overindulgence in terms of alcohol. And when people indulge a little too much during the holidays and festivities, they can also lead to sort of slip and fall, even at home. So you're not sort of steady on your feet. And as we age, our balance changes anyway. So, so we got this sort of deadly triad of stress, a little overindulgence, and an unbalance. And so that can lead to a significant fall and injury.
So true. And then I think also like a lot of times people will cope with stress with their cell phone. And that probably, like you were saying, the stooped posture of looking down can kind of put a little bit more stress on your neck as well.
That's right. Yeah, so we are seeing more and more tech neck, where people are looking down more. So I tell patients and people with that problem to kind of, when they're looking and reading their things, to kind of bring it up. So proper body ergonomics, so iPad holders and phone holders that are more kind of higher up and kind of looking straight ahead rather than looking down, It's very important.
Very good tips. Such great tips, not only for the holiday season, but just any time. So thanks, Dr. Mody, for joining us. But tell us, if someone is wanting to, come see you in your office, where are you located and what is your phone number?
Sure. We're located at the Portico Shopping Center, which is 7925 Uri Drive, Shreveport, Louisiana, and which is right across Willis Knighton Piermont Hospital. And our phone number is 318-212-3610. 318-212-3610.
All right, good deal. Thanks for joining us, and Merry Christmas to you and yours this season. And if you missed this and you wanted to rewatch this, you can find this on KTBS.com/podcast or KTBS.com KTBS.com/Healthline, the number 3. Thanks for joining us.
Merry Christmas.